As we've grown and progressed as an organisation, we've moved very much into the advocacy side of things, and we've moved from being the caregiver and the supporter to being the experts and the opinion leaders to some extent. And with that switch over, we've realised that advocacy is best supported with improved data and publications and research. And it was the one thing that we were missing to really strengthen our advocacy work. So it just seemed like the next logical step to bring on a rare research division where we could focus on the gaps that we've seen from a data perspective, and we could bridge those gaps so that we could ultimately improve and strengthen our advocacy work.
The most important thing really is getting a diagnosis. In many cases, for many conditions, we know that there are 7,000 rare diseases that have been characterized or identified, but for so many of them, they don't have a diagnostic test necessarily, and there's so many conditions that don't actually get diagnosed. And I think it's the first most important step is just knowing what you're dealing with as a parent, but also from the other side, and kind of bridging that gap with the healthcare provider and professional in terms of knowing what you're dealing with so you can better provide the care, support and management for that condition, whether it's a severely life-limiting condition with only a few hours, days or weeks of life, or a longer term, more chronic life-limiting condition with years involved.
I think funding is a big issue, so I think especially in the field that we're interested in, which is rare disease research, there isn't always as many funding opportunities, especially in South Africa. And I think the second thing is maybe the skill set. So I think there's a need for unique skills in genetics and genomics, in bioinformatics. So there is a scarcity of those skills in the country, so trying to pull a team together is sometimes challenging. And then I guess the third thing is to really try and reach the patients who would be the participants in our research studies, really to find the right match and to get people involved in the research. I wouldn't say it's something that we're struggling with, but it is something that I think we need to work on to make sure that we reach as many patients as possible.
Historically in South Africa, we have a lot of good research going on. I think the real key is translating that into actual treatments. We have a lot of infrastructure, but it's just getting everybody to work together and unite, and so that we work as a whole rather than individual little silos.